One of the most common cardiac irregularities is called atrial fibrillation. Atrial fibrillation is an irregularity where the upper chamber of the heart, instead of beating on a regular basis, is actually quivering like a bowl of jelly. So the heart now is inefficient because it loses its 1-2 punch. The atrium is the leader of the dance, and now it's just quivering, and it causes the bottom part, which is the main pumping chamber of the heart, to be irregular. Atrial fibrillation is one of the more common cardiac irregularities, and there are numerous causes of patients for atrial fibrillation. One of the common scenarios, in fact, is called the holiday heart syndrome, where patients tend to overindulge or over-imbibe on certain holidays and present to the emergency room with a rapid heartbeat, maybe some lightheadedness, and maybe some sweating. It's more commonly seen as we get older. So as patients get older, it's a condition that's seen more and more often. It can be related to things such as high blood pressure or valvular heart disease that has been not perfectly well controlled. Even if it's been controlled over time, as the ventricle gets stiffer, that causes the atrium to stretch out, and that can cause atrial fibrillation. Less commonly, we can get atrial fibrillation from things like overindulgence of caffeine, caffeinated beverages, cardiac stimulants, and then some medical causes like thyroid abnormalities and things like that can also cause atrial fibrillation. Finally, coronary artery disease, which is blockages of the arteries in the heart, can make the heart also stiffer and more prone to atrial fibrillation. Atrial fibrillation is typically not a life-threatening condition. It can be very annoying, it can be even very scary, even causing some people to feel somewhat panicky, because as your heart goes fast, not only do you feel it beating in your chest, you can get a sensation of being dizzy, lightheaded, some chest discomfort, some shortness of breath. All these symptoms are possible, but in general, it's not life-threatening. The worst thing about atrial fibrillation is the potential that it could lead to blood clots. When the atrium is quivering instead of beating, the blood tends to stagnate and leading to an increased situation where blood clots potentially could form.